NOFAS Colorado grew out of the Colorado Fetal Alcohol and Drug Abuse Coalition, which was started by a couple of doctors at Children's Hospital back in the 90s. We incorporated, I believe, in 2007 to become a nonprofit organization so that we could begin to provide real services to families. Well, we have support groups that we're working with of parents, both adoptive parents and birth parents, helping them get diagnoses and understand what that means. We go with them to the schools so that they can try to get individualized education plans that are appropriate. My husband and I also were foster parents for children who'd been committed because of delinquency. That's where we first realized that fetal alcohol was an issue. We had 2 young men in our home that had fetal alcohol syndrome, and then after that we adopted 2 little girls who we knew were prenatally exposed, but we didn't really realize that their issues were because of that prenatal exposure. Took us about 7 or 8 years to catch on to that, and that's when we really started researching in the field and I started doing training. We tried everything. We went to all the parenting classes, we tried every parenting system that anyone could suggest to us, and it simply didn't work. So that's when we started looking at the substance abuse issues and began to understand that our children didn't process the same. They didn't understand cause and effect. So the parenting that we were doing was actually making life harder for them rather than easier. One of the things that makes this field difficult is that every child is different. So we have to understand how our particular child or the particular child we're working with learns, what their needs are, what gaps they have in their development that we have to simply compensate for. Well, the one that made us realize that we were dealing with something else was tantruming. We tried, our daughter tantrumed all the time. Actually, looking back, when we got her at 3.5, she was a headbanger. She was simply out there and emotionally as well as physically trying to get something out. We tried every kind of a behavior management system, including finally a role play kind of model. And that's when we realized that she really didn't understand cause and effect and she couldn't stop tantruming. So that's when we started looking for some totally different way to deal with it, and we realized that the way to keep her from tantruming was to modify her environment so that there weren't things that were totally frustrating her, so that she was in a world she could understand. She doesn't understand time, she doesn't understand a lot of abstract concepts, and as long as those were the concepts she was dealing with, she was going to lose it. So we needed to present things to her in a way that she could understand and in a way that wasn't threatening to her. She's on the edge very often. She's very close to being totally afraid of the world she lives in. And so we need to create a world where she can be comfortable. And in the last 13 or 14 years, we've been able to do that. Her sister has a completely different package of disabilities, and hers were more in the learning kinds of things that our schools know how to deal with. The schools didn't know how to deal with a child who was terrified all the time. She's grown a huge amount. I mean, there was a time, well, she went through a psychotic break. She spent months in a psychiatric hospital. She went through residential treatment. She got into the drug scene. She got into sexual promiscuity, which she didn't know. She really went through it. She became assaultive and ended up in jail. Over time, we've been able to structure a world where she can survive, where she 7 weeks now, she's lived independently in her own apartment. She has staff during the day, she has programming, she has a job that she goes to 2 days a week. She's pretty functional. She can ride the buses. Once she learns the system, she sets up charts for herself. She creates a structure for herself now, where she has the things she needs to do, and she checks off the things that she's done, and she creates that structure for herself. That's taken many, many years. She was actually the Consumer of the Year for the Developmental Disabilities Program where we live last year, and there was a video of her on YouTube going through all the things that she's done to make her world something that she can cope with. Well, NOFAS Colorado is here. We want to create supports for families. We want to also create a place where professionals can come for support and for training, where we can refer people where they can get other kinds of help, because there are programs going on in the state. We want to collaborate with other organizations and make as much support available for families as we possibly can.